Hey everyone, and welcome. We're so glad you could join us for the University of Michigan Population and Health Sciences Online MPH webinar. We know our audience is joining in from across the US and around the globe, and we're really excited to have you here. I'm Lisa Garber, the Program Manager for the Online MPH, and I'm joined by Jean Rinkowski, who's a recent graduate and is here to give you an honest look at life in the program and to share her perspective as an alum. Tonight, we want to help you figure out if this program is the right next step for you. We'll cover what you'll study, what it's really like to be a student, and how it can support your career goals in public health. Throughout this webinar, though, please feel free to add your questions to the chat. We'll answer as many as we can during Q&A, and Jean and I are happy to follow up afterward if we miss anything. To get started, let's ground ourselves in what population health really means and explore the things that make this program unique. When we talk about population health, we mean improving health outcomes at the community or systems level, not just treating individual patients. It's about understanding and addressing the conditions that shape health, like access to care, environmental exposures, social and economic factors, and policy decisions, so that entire populations can be healthier. This lens guides everything that we do in our program, how we design courses, what we teach, the kinds of problems our students learn to tackle. For example, you might analyze patterns of disease in a city. You might evaluate the impact of a public health policy or design interventions to reduce health disparities. By thinking about health at this broader level, you learn to apply data, evidence, and systems thinking to make meaningful, lasting change. Our curriculum is designed to give both breadth and adaptability. Our core courses ensure you gain a solid grounding in key public health areas, including epidemiology, biostatistics, nutrition, policy, health behavior and equity, and leadership. And then, with a wide range of electives, you can dive deeper into the topics that matter most to your career, building skills that directly support your professional path. We also emphasize real-world practice. Students complete applied projects and capstone experiences that let them put classroom knowledge into action. For example, working with a community organization, a public health agency, or healthcare system to produce meaningful deliverables. And this is all built to fit work and life. The program's fully online with a combination of live Zoom sessions and asynchronous coursework on Canvas. You can engage with lectures, assignments, and discussion boards around your own schedule, while still maintaining meaningful interaction with faculty and peers. Our students are a diverse and dynamic group, including seasoned working professionals, early career staff, and those changing careers, all united by a passion for making an impact. They come from healthcare, academia, government, nonprofits, research, and business, and this diversity really enriches the learning environment for everyone. Even though most of our students balance full-time work with their studies, they're committed. They engage in live classes, participate in Slack conversations, and make full use of the support available, which include academic advising, our academic success coach, the school's writing lab, and extensive digital resources in the university libraries. By taking advantage of these resources, students really set themselves up for success throughout the program. So let's take a closer look at how the program's structured, the courses you'll take, the rhythm of your weeks, and what it takes to reach graduation. This program is designed to be completed in 2 years, with a minimum of 42 credits, though some students choose to slow their pace down or take breaks as needed. As long as all degree requirements are finished within 5 years, students can progress at a schedule that works for them. And we stay in close contact to help plan each student's program. And that's one of the things that I'm here for. For those following a standard timeline, though, the program's organized into 6 terms, with 2 courses running at a time in 8-week blocks. Students typically spend about 15 to 20 hours per week on coursework, which usually allows studying to fit alongside full-time work and other commitments too. This pacing keeps your workload focused, lets you engage consistently, and provides a clear, predictable rhythm. Most of the required courses take place in the first year and give you a strong foundation in public health. In the second year, you'll have the opportunity to tailor your degree by choosing electives that align with your career goals. You'll also complete 2 applied experiences as part of your coursework. You'll see them on here as the Applied Practice Experience, or APEX, in the fall term, and the Integrated Learning Experience, or ILE, in the winter term. These courses provide hands-on, real-world opportunities to apply the skills you've developed throughout the program, and each one counts as one of the 2 courses you take at a time. Tuition is assessed per credit. The total program cost for 42 credits over 2 years is approximately $53,000 right now for in-state students and $58,000 for out-of-state students, including international students. So that covers the whole cost of the program if you take 42 credits. Many students will take advantage of scholarships and financial aid opportunities, and you pay term by term rather than all at once, which makes the program more manageable financially. Scholarship awards, in particular from the School of Public Health, are based on both need and merit, and these can cover up to 25% of your total tuition. To be considered for those, you don't need to submit anything beyond your regular application for admission. U.S. students might also complete the FAFSA for federal aid, which is typically in the form of student loans. Now we can take a closer look at the first year foundation, the courses you'll take and how they're sequenced. The first fall term includes social determinants of health and epidemiology in the first 8 weeks, and then nutrition and biostatistics in the next 8 weeks. So right now, our first year students are in week 9 of the program. So they're just beginning the second half of fall term with nutrition and biostats. Their live class sessions will be tonight and tomorrow at 7 p.m. Eastern Time, just like this webinar. And the assignments for the week are due Sunday night before the next week begins. The first winter term pairs communication fundamentals with public health systems, policy, and management in those first 8 weeks, and then environmental health and population health in the second 8 weeks. This sequencing helps you build a really strong foundation across the key public health domains before you start selecting electives in your second year. And it reflects that rhythm that we mentioned earlier, the 2 courses at a time, structured 8-week blocks, and roughly 15 to 20 hours per week. After completing your first year core courses, you'll have a chance to tailor your studies to your interests with electives in areas like epidemiology, health behavior and health equity, environmental health sciences, and health management and policy, plus a couple of options in nutritional sciences. Most students take 1 elective at a time during 1 8-week block and complete 7 to 8 electives in total. Alongside these electives, you'll complete 2 experience-based courses. So in the fall term of second year, you'll be taking Pub Health 680 for the Applied Practice Experience, or APEX, and that's where you work directly with an organization, usually remotely, to complete meaningful deliverables. And then in the winter term, you'll take Pub Health 681 for the Integrated Learning Experience, or ILE, which is a capstone project on a topic of your choosing and a style of your choosing. Together, these experiences will give you both depth in your areas of interest and some hands-on practice that you can apply right away. So with all that said, I'd really like to turn things over to Jean, and she can share an insider's perspective on what it's really like to be a student in the program, all the way from deciding to enroll, balancing coursework with work and life, and building relationships with peers and faculty, and then making the most of the applied experiences too. So Jean, could you start us out by sharing probably first why you chose Michigan Public Health? And then we'll get into the details of your experience.
Hello, everyone. My name's Jean. So I just graduated in August. And I guess, so I actually live only an hour south of University of Michigan, but I did not initially know that they had this program. So when I was looking into different programs that were available in online programs, I was a bit concerned about cost because as many of you know, things are expensive these days. Um, but I found out about the scholarship program that Lisa mentioned, and I did end up being eligible for that and able to get a scholarship. So that helped. And for my job and my life, I have five young kids now, but when I started the program, I had four. And so, and I believe they were all under seven at the time. Now they're nine and under, but um, I needed flexibility. So I work as a physical therapist. I do have some flexibility in my schedule. I did switch from full-time to part-time, but that wasn't just because of the program. That was something I was doing anyways. But I liked the all the opportunities that Michigan offered. The online scheduling and the regularity of the classes, like Lisa mentioned, was a huge bonus because I could predict ahead of time when my classes would be, when they were meeting, and I'm in Eastern time zone, so the time worked out really well for me. I knew when things were going to be due. I really liked the idea of all the electives that were available, and I liked that you could mix and match within the electives. Like you didn't have to just choose one track. Like it seemed like some of the other programs, you had to decide ahead of time like what you wanted to do. So the nice thing was if you started with one elective series and you're like, I don't know if this is what I wanted, you could switch. It wasn't a big deal. Lisa was great. You just would email Lisa and she would make it happen. I really liked too when I looked more into Michigan, the just diverse experiences and expertise of all the faculty within the program. And most of the faculty that we're teaching, I think all of them actually also teach, you're getting the same instructors you would have if you were going in person. These instructors teach all different courses, tons of expertise. They all, there's lots of research. If you look up any of the professors, it shows all the research that they do. A lot of the faculty is very involved in public health in general, professionally in um, just important causes. And I liked that. I thought it was nice to see that people were, practicing what they preach and really working ahead. And I like an online program. I had done online previously, and it allowed me to keep working full time while I was taking classes for my other program that I did. So I was comfortable with online, but that was a big plus for me. And like I said, the cost when I figured it out and did all the math, it ended up being very cost effective compared to a lot of other programs I was looking at. And it was not that far from home, so that was an added bonus.
Thanks, Jean. Um, can you think back to pre-graduation before you left us in August and walk through maybe a sample week? I don't know if there's ever a typical week, but maybe what one week might look like as you try to study in this program.
So it worked out. I liked the regularity. I think our classes were either on Tuesday, Wednesday, or Thursday night, depending on the classes. So that was nice. I always knew just like keep Tuesday, Wednesday, Thursday open in the evenings, which in Eastern time, and it worked out. And then our assignments generally were due Sunday nights at like 11:59 p.m. or whatever. So basically midnight. But I liked that because I knew, how to plan my work schedule and my study schedule. And I would work on things a lot of times during the week, in the evenings after my kids went to bed versus some of my classmates, the week was too hectic for them. So they would do a lot on the weekend. Like maybe if they didn't have kids, they found it easier to do on the weekend. But with that predictability, you get into a rhythm pretty quickly. And so it allowed me the flexibility and to work with my husband and my kids' schedule and be able to be like, okay, I'm going to block out this time that I'm going to do work on this class. And then it worked out too that a lot of us, even being in different time zones and being an online program, like when we were going through, say, biostatistics or, some of the harder classes, we were able to, make study groups where we'd be like, okay, we don't have class on this night. Let's all meet on like Thursday night at this time so we can kind of go through all these problem sets and like help each other. And, and the faculty encouraged that. And it really helped, I feel like, our learning. Um, so that was important and helpful. But I think the hour, like the time amount that you gave was accurate. That's probably about how much time I spent. Give or take. Some classes were a little more, a little less, but in general. And I feel like the first year, I think with the required courses were a little bit more time consuming. And I felt like once you got to the electives, it wasn't quite as much, but that partly may just because you're taking a little bit of everything, so not everything is something that maybe is in your wheelhouse.
That's good to know. You have on here kind of a range of electives. So you did EPID, you did environmental health, and you did health policy assessment. So I don't know where you want to start with those, Jean, but can you tell us just a little bit more about the how you chose maybe which electives you want to do and how they're working out for you?
So initially, when I went into the program, I knew for sure that I wanted to do epidemiology electives because I wanted to get into doing more research than what I'm doing in my current career. And so that was a for sure for me. And then I've always been interested in environmental health and how it impacts, our physical and our mental health. And then health policy was something I was kind of interested in, but I also was not someone who was very, I guess, say into politics at first. But when I took one of our first classes was social determinants of health, and I realized pretty quickly that the best way to get change that can affect, on a population level is to change the policy, go as far upstream as you can go and get, try and change the policy so we can get funding allocated. And now some of my classmates, they liked working more like in the trenches and doing more, like working at the health department and like working with people one-on-one. And so it was nice to see the interesting I mean, we had people from all over, all different professions. It was really great. But that's kind of how I ended up where going through that kind of elective series area. But I liked because you could pick and choose. And I mean, there were other electives too that I would have loved to take. I just didn't have time. Um, but I would have loved all the classes really.
I hear that often, Jean. People say, I could stay here forever.
Yes.
But, you
If it
know,
was free.
you do have to make some choices. We only have
Yeah.
so much time
Yeah.
in our schedules. So I'm glad that you were able to find some that really were meaningful to you and kind of rounded out your whole program. If you think back to some of those courses, can you think of a really cool assignment that you got to do or some aha moments that were kind of memorable for you?
Um, I think one of the really fun assignments, Dr. Cardio, when she had us do, oh, I'm drawing a blank in the class. We had to do like the opioid simulation, and we actually took on the roles of like real people, people that would be working on this, and we worked in groups, and we had to have a funding plan. We had decided what intervention we wanted to do, and we were actually playing the roles of the people, and so we had to like research. We got to pick, there was like a list of suggestions, or you could bring your own person that you wanted to be, but it was super fascinating because it really made it more of like a real life experience. And ironically, one of the people that was an option to choose to be was someone that I know from the local community that started like a drug treatment center and has been very involved in addressing the opioid epidemic in Ohio. So I thought that was really fun um, and a great learning experience. And I think the Apex experience as well, that was really nice being able to tailor that to your interests, working with you, Lisa, and then working with the faculty, the other faculty and professors. I mean, we had so many options. I guess that was my one concern being in an online program was, what options do we actually have to do that you're not going to have to go in person? But I was actually able to do, me and a couple of my classmates worked with the researchers in California on the California teacher study. We were able to do data analysis. And then I'm still actually finishing up. Well, I finished the class, obviously, to graduate, but we're still trying, working towards getting that paper published to see if we can get it published. So that's really exciting. And that's something that I didn't know if that would even be an option in an online program. So that is really exciting. And I think how all the classes, I feel like no matter what you did or what you choose elective wise, all the classes somehow build upon each other going towards the main goal. And I really liked that, I don't even know if it was something intentional, it was everything tied together so nicely that you allowed you to make these connections and see the big picture in public health.
In many ways, it is intentional, Jean. We try to have a pretty comprehensive curriculum that no matter what choices you make along the way, you're getting that big picture population health view, and you can really take the competencies that you've mastered and the hands-on experience that you've put in your portfolio and run with it in any direction. Um, so we have a question in the chat right now that we can take a moment to answer. Are there any opportunities to participate in research or mentorship from faculty despite being online? Um, you did a little bit of research and built a lot
Mhm.
of relationships with faculty. Jean, do you want to take a
Yeah.
stab at just some actual examples?
Yeah, so I think I guess working with faculty, so we had so many opportunities, despite the classes being shorter, I feel like the faculty are very invested in mentorship options, and opportunities, and they are really invested in the students doing well. Like pretty much everyone, as far as I can remember, was like, just email me if you have a problem. If you're having, a personal issue that you need to modify anything, let me know. Very flexible. And then if there's something you're more interested in, working with them on, you could ask them. I know for Apex, we had the opportunity to work with, the California Teacher Study, and I know there was a bunch of other opportunities as well to do like actual research. So I mean, we put together, me and my classmates that worked with that staff out in California. We each kind of had a slightly different subject. So we were each doing our own data analysis. So I mean, we had to learn all the how to do all the coding and everything, which we did with Dr. Levin, and and bless her, she is so wonderful. So she spent a lot of time with us students, even outside of class time, making sure we understood if we were coming across any problems, if our code wasn't working, to make sure that we could do the data analysis properly. And then when it came time to actually like put all the research together and the data analysis into the writing the paper, I mean, she was willing to meet outside of class time. Everyone was just so helpful. And I don't my other degree, my physical therapy degree is, from a while ago, but it's just you really don't feel like you're in an online program. So I do feel like there are opportunities, and Lisa, you'll have to correct me if I'm wrong, but I can't remember with Apex if you had to do something with someone outside of the university or not. But I know like the Institute for Firearm Prevention, I feel like one of my classmates did something with that. So the university has all these different like research institutes, which I think is kind of I don't know if that's true of other universities, but Michigan has so many, I can't even keep track of all of them, um, that students had the opportunity to do work with. And you get emails all the time about, options that students can be involved in different little research things. So I feel like there's still um, options to do research. And that was one of my big things. I wanted to be able to learn to do research better. And so I feel like I really was able to do that. And the other question, online epidemiology. So yes, there are, well, at least you can correct me, but there were a lot of epidemiology elective options.
Yeah, so we have 11 total credits to choose from, and um, you really only need 19 credits of electives to meet degree requirements. So you'll take 23 core required credits and then 19 electives to reach your total um, 42 in the program. Jean, I think you took a couple extra beyond
Yeah.
42 to really
Yes.
round out your full program plan.
Um,
But that does include 11 credits in epidemiology, which altogether, so that's 4 classes. You'll learn the basic principles of epidemiology, like beyond the intro course. It includes a course specifically in coding. Right now, we're using R and R Studio Cloud because they're free and available, and so we can use them thoroughly in lots of different markets without necessarily having the deep pockets to purchase other software. Um, and so all of those classes total up to a certificate in applied epidemiology. So if you do take corresponding courses, like all 11 credits within epidemiology, you can earn up to one certificate that goes alongside your MPH without taking additional classes. So those can be a handy extra credential that you have on your transcript.
I think the other question about the criminal justice system and incarceration, I don't know if there's specific classes, but I know Dr. Lopez is very involved in that. And he teaches some of the other classes and is always so happy to talk to people about that, or if other people want to get involved in that, he loves having students help.
Yeah, and you meet Dr. Lopez first out of the gate. So he teaches social determinants of health. His research focuses on, he's got kind of two main populations. He focuses on incarcerated individuals and then um, immigration
Hmm.
concerns within public health. So he kind of hits both of those in his own research and works with students either within a class to design your own project based on topics of interest like that, or sometimes extracurricular opportunities as well.
Online online students can walk the stage. Yeah, they do the full graduation. Yes, you can do the whole thing.
Yeah, it's definitely worth coming to Ann Arbor. Um, Our online students are full University of Michigan students. So you're welcome on campus. You can have an M card, a student ID. You can go to seminars. So if you want to physically come to campus, you are more than welcome on campus. The one time that we do specific in-person programming for this program is usually during graduation, where it's oftentimes the first time any of us have seen each other in 3D, and that's a great time to see all of your professors and peers that you've made really close connections with along the way. So I'm just going to take a pause on some of these questions right now because I think that we have a little bit of content that will address them, and then we'll circle back and have plenty of more time to get into Q&A after this. Because one of those questions is what we look for in applicants. Um, so we can talk about who really succeeds in this program and what we're looking for when we review your application, make decisions on scholarship and admission. So when our committee reviews applications, we're really looking for evidence of both readiness and purpose. So we want to know you're prepared for graduate level study at the University of Michigan. It's a rigorous program. And that you have a clear sense of why this program is the right fit for your goals. Academically, we're looking for a pretty strong overall performance, especially in quantitative courses like statistics, since those are essential foundations that you'll hit in biostatistics and epidemiology. We don't have a minimum GPA score. And so we're really looking at your overall package, but the academic component is one of those key areas. Just as much, we value your experience in any setting where you've demonstrated leadership, service, or engagement with public health issues. So that could be through professional work, research, community organizing, or volunteer efforts. It doesn't have to be super formal. We also pay close attention to fit and how you actually articulate your interests, your professional goals, and connection to population health. And then finally, we're looking at your dedication. Public health is a field rooted in purpose, and we want to see that you're genuinely motivated to improve health outcomes and equity in the communities or systems that you'll ultimately serve. So we can talk about how you tell us all of that, though, as well. You actually apply through SOFIS, which is the centralized application system used by most public health programs across the country. So you go to SOFIS, get your application started, and then you'll tailor further for each program that you want to apply to. And for us, you need to include a statement of purpose, and that's where you can explain your academic and professional goals and why Michigan's Online MPH feels like the right fit for you. And there's a separate optional reflective essay. It's your chance to share experiences, values, or circumstances that might not show up elsewhere in your application. Some applicants use it to give context for maybe a challenging semester on their transcripts, time away from school or work, or other life experiences that shaped their path that they want the committee to know about. And then the third statement is often pretty short. It's the quantitative statement, and that helps us understand your background in math, statistics, or data, whether that comes from classes, research, or work experience. We, of course, have access to your transcripts. You'll upload those as part of your whole application, but you can share commentary on anything that's on your transcript, or spend some time discussing other ways that you've got your quantitative skills up outside of formal classes. Sometimes students do that on Coursera or other, open content platforms. We're happy to hear about those. So in addition to those official transcripts, you'll need a resume or a CV and 3 letters of recommendation. So those should be from people who can speak to your readiness and your potential to succeed in grad school. That's typically academic or professional references. Um, Former professors probably come to mind first, but many of our students have been out of school for several years and instead might choose supervisors, colleagues, or mentors who can speak about their current skills and experience, and that's totally fine. And then if English isn't your first language, you'll include English language exam scores as well. So those are things like IELTS or TOEFL. And then you'll note that the GRE is not on this list. We don't require the GRE for this program, actually for the whole School of Public Health, because we all find that the best predictors of success are really in your writing, your academic prep, and then your professional drive, not a standardized test score. Jean, as somebody who's been through this process, maybe a little bit ago at this point, but do you have advice that you would share for applicants who are just starting to think about putting this together?
I would say, as Lisa mentioned, if you had, say, a bad semester or something that happened in your life previously that, maybe you've worked past at this point, don't be afraid to mention that. I think, like she said, they really take that into account. I had a period, like early on in my college career where I got sick. I had a lot of health issues. My grades were just horrible that year, so I was able to write about that. And I think, when you fill out all the paperwork, I would suggest, make sure you are addressing, take the time to, make sure you're doing your statement of purpose and the reflection and everything. And really, take the time if something like that happens to explain it. One of my other classmates, he had said too, he previously was not, the strongest student when he went through undergrad, but, he did well in the program and he was really an asset and brought a lot of different, experiences in, to the program. So I think, if that has been an issue in the past, don't let that deter you as long as, like Lisa said, you can keep up with the academic things now. And I think too, when you're filling it out, focus on your why. Why do you want to do this? And I think, especially if you're at this meeting, given what's going on in the country right now, if you're going into public health, knowing what's happening right now, you clearly have a very strong reason that you want to do this. So that shouldn't be any problem, I don't think, to write that part for most people, because you clearly are very passionate about it, um, wanting to go into it. So I think just, really think about yourself and what your goals are and what, makes you special and what you can bring to the program. Because we had people from, all different professional backgrounds, different personal backgrounds. We had people from around the country. We had people from outside the country. And I really think that was another strength of the program. Being online, we had much more diversity in the program than I think you would probably get in an in-person program. We had people that were right out of undergrad. We had people that had been working professionally for decades. And it really brought so much to the program. So focus on what makes you special and unique and what you can bring, not just, not what just what you can gain from the program, but what you can bring to the program too. What experiences could you bring that, are going to benefit other people? Because I really think that is a big strength of the program, the diversity and like everyone working together as a team. And you're not just learning from the professors, we all learned from each other. And I think that was really important.
Yeah, thanks, Jean. That's a really good summary of what we're looking for on the committee. We're real people. I do not make admissions decisions, so we can have candid conversations anytime about where you're at in the process. But we, the committee, are real humans reading your application and want to know your story. We're not seeing transcripts that don't have a 4.0 on them. Most don't have a 4.0 on them, and setting them in a reject pile. That is not the way that we handle this program. So tell us your story wherever you are at this stage of your career. We're happy to hear about it. Um, as we get closer to the admissions or the application deadline, so the first one's coming up in February 15 is the priority deadline, and then we'll continue taking applications far after that as well. But February 15 is really around the time that we're ramping up our first round of application submissions and then decisions. Our admissions chair is also our program director. Her name is Dr. Kim Lucius, and she hosts coaching sessions. So if you want to come in and talk to her about a specific part of your application or making sure that you're presenting yourself in the right light, she takes all of those conversations very seriously and separates them from anything that she's doing to actually review your application. So keep an eye out for those events coming up.
I'm just going to jump in real quick and say I believe you guys hosted something similar before I applied, and I 100% recommend taking advantage of that because it was really helpful to understand what they were looking for and how I could best present myself.
I'm glad that was helpful. We like to offer all of these things. This is a really high contact program for sure. So staff are available to you. Um, our student services folks are available to you. Our admissions chair is available. The faculty are here. Everybody really wants to know who you are, what you need to succeed, and help you become awesome colleagues for all of us in public health. Let's see. So that's the formal portion that I have for the webinar. So I know that there are already some questions in the chat that we'll hop to, but feel free to keep adding to those as we go. So one of them, I think, Jean, you and I can both address this. So Frank has concerns that employers will want to look for graduating with specific concentrations from an MPH. So not population and health sciences, which is general, but an MPH in epidemiology specifically in a job application. And um, it it can be, you do want to think about what your ultimate discipline is. So do you want the population health bird's eye overview where you understand all of the different components within public health and can work with the epidemiologists and the biostatisticians and the nutritionists and the registered dietitians? Or do you want one of those very specific credentials? Unfortunately, U of M doesn't offer any other online degree programs. There's a number of them that are available residentially that tends to be more credits than the 42 that we require and then require physical presence on campus. So something to consider, but I would say one of the most effective ways to test that would probably to be going out to a job search site like indeed.com and look at some aspirational job titles and what they're actually looking for in their job postings. Usually, if somebody's going to want that specific epidemiology credential, the requirements will say 60 credit hours in epidemiology required for this position. So even if this were an epidemiology program, we don't have 60 credits within the curriculum. So it's worth taking a look at some of those examples before you commit to a program. Once you do commit to this program, we have a careers team that's really valuable as well. So, Jean, I don't know if you met with our careers team at all while you were enrolled here. They're still available to you as a new alumna. They'll still meet with you.
Yeah, I met with them several times. They offered there's a lot of webinars. So I would try and go to those. They put on lots of webinars. Um, there are just so many resources that the university offered. I didn't even have time to take advantage of them all, but like I used the Career Center. One of the opportunities the Career Center had is they have a student alumni mentorship program, which was really nice, where you could sign up, and it was all free, but you could sign up to be paired with a mentor that's an alumni, and you could it's based on what's available each year that they do it, but you could say, I'm interested in this type of career. Can you pair me with, someone of similar background? And they would do their best to pair you with that. But that was something that was really helpful. But I did meet with the Career Center at one point when I was trying to decide my electives. Um, and say like, this is what I think I want to do. Like, how can I best, um, fulfill that? And they did suggest too, like you said, go on some of the job sites, look at what they're asking for, things that you think you'd be interested in, look at what they're asking for, because that can kind of give you an idea of what you might need academically in a program to get a job like that. But even a lot of the ones that I saw that they don't seem like, most of them I think it'd be a matter of, you'd have to be able to prove your skill level, it seems like, like if you were going to do data analysis, even if though say your degree might not say, biostatistics or statistics or that type of thing. If you have enough experience in it in the classes, you could prove your knowledge, I think pretty easily. So that's my experience so far. And then speaking of services, I also utilized the Writing Center several times, and that was super helpful. They tell you with each class about it, all the different options that you have um, to utilize. And I utilized that several times, and it's been super helpful. I mean, she helped me with all different kinds of projects, for different classes. And it was just really nice for me to be able to bounce ideas off of someone. And then even just talking with her about, how to increase my efficiency with reading research and, kind of digesting it and doing literature reviews because that was something I wanted to get more efficient on. She was able to work on things like that too.
That's super helpful. There's one comment in here from Shannon who really appreciates your insights and is interested in knowing a little bit more about the various institutes that the university is connected to. I'll pull up some links that I can share about our institutes, but Jean, do you have insights into the institutes that you were mentioning?
Yeah, I was going to ask if you have a list because there's so many, so many.
There are many, and I'll
Yes.
post the list so that
Okay.
everybody can take a look through.
And I think I don't
Usually,
think
as you click through those pieces, you'll get into a little wormhole of, oh my gosh, this is okay. This includes faculty from School of Public Health and faculty from medicine and faculty from social work, and so it kind of represents that whole university network that you get access to.
I think I don't know. I don't think there's specifically any guarantee that you would get to work with a particular institute, but like I said, I know one of my classmates was really interested in studying gun violence, and so she was able to do a project with that was Bridget. She worked with the Institute for Firearm. I forget what it's called, firearm safety, or
Firearm Injury Prevention Center, I
that's
believe.
what it is.
Yeah,
Yes,
one of our
yes.
alumni from the very first cohort, Chris, worked there for a long time. I'm not sure if he's still there, but got a job there during the program even. I don't think that happened
And I
afterward.
feel like I just got an email too about there's different ones of those will send out emails and say, we have options for students or even like summer internships and things like that. So, I mean, even if you are an online student, I believe you can still apply for those, say for summer if you wanted to do something, you might have to go to Ann Arbor, but I mean, you can still sign up for those from my knowledge. Is that correct, Lisa?
Yeah, I mean, it's a 2-year program and you're students, so you have that student eligibility. If an internship requires, student status, you have it for 2 whole years, 2 summers. Um, Sometimes I see remote internships full stop, and that would be great. Sometimes they're on campus or hybrid. But yeah, you can definitely apply for internships. Our careers team does a lot of work with students on helping them choose internships. They're required for residential students, so they're very well connected. But we can take advantage of that as online students. They're not required. Most of our students are working full time, and so it would be really hard to fit in an official internships. It's not really fair of us to require that of you, but you're allowed to do it. Um, and spring and summer are a great time to do it because usually you'll only be taking one elective and not a second course during spring or summer.
I see the thing about help with job placement after graduation. And yes, the Career Center, as Lisa said, so you can utilize it while you're a student. You can utilize it after graduation. They have job postings that are just um, for, University of Michigan students and alumni. You can set up alerts. They are so helpful. Like if you want to sit down and have someone go through your LinkedIn with you, go through your resume, they do all that, and they do fairly frequent webinars on all these different things, and they record them if you can't attend live. And then if you still have more questions, you just schedule, you go online, you schedule to meet with them, and they're happy to meet with you as many times as you want. I mean, I met with them a lot because I'm, kind of changing career trajectories at this point. So I just had a lot of questions about that, how to best represent things and write things and things like that. But it was there's just so many resources, and I think that's something that even going into the program, I knew there was a lot, but there was even more than I could have fathomed because essentially you can still access just about anything that you could access in person, but you're just doing it online and everyone's happy to meet with you online.
Yeah, that's one of the things that I love so much about this program is that you really can access most of our university and school resources online from wherever you are. So, Jean, you mentioned you're doing some changes in your career. You've got a little bit of a trajectory shift. Um, Tell us about that. Did this program inspire it?
Yeah, so I knew I was interested in public health while I was working. So I'm a physical therapist and I've been working as a clinician for probably over 20 years now. But I knew, I was seeing the same things over and over again and the same roadblocks, and it was very frustrating, to see all these problems like at the bottom end where you can't really, people can't come because their copay is too high and their insurance visits are limited, or they have these other, like social determinant of health issues that are preventing them from really getting the care or being able to give themselves the care that they need. And so that was part of what inspired me to go into public health. And then, like I said, within the program, my trajectory switched a little bit because I realized how important health policy was. And then in my more recent classes, learning more about healthcare cost analysis, and I realized that we can use that to kind of leverage and motivate policymakers to make changes by showing that public health is more cost effective. So um, I ended up getting involved with the American Public Health Association, and so um, this wasn't my plan. It just kind of happened. But so now I'm actually going to be serving as the secretary of the environmental section, starting after the annual meeting in November, which is not something I ever pictured myself doing. Um, but the opportunity presented itself, and I was able to get. So it is a volunteer position, but at this point in my life, I'm realizing because I was looking at different jobs and I wasn't quite sure which way I wanted to go. And at this point in my life, I like the flexibility that I have with my kids being young, and so this is enabling me to get a lot of experience and work on things I want to and kind of have a little bit more control over my time commitments, but also be very involved. And I just feel like with everything going on in the world and especially our country right now, um, I just felt a calling like this was the right thing to do for me right now. Um, so I'll be doing that. Like I said, it's a 2-year commitment starting in November. But then, so I've met so many wonderful people within public health. I've been able to network, meet people from all over the country, people very passionate about public health, and work on rewriting some of the policies, which is something I was interested anyway. So I'm getting a lot of practice and experience. And I realize not everyone has the ability to, do volunteer work that doesn't necessarily pay. But at this point in my life, I do have that flexibility. So I decided that it was meant to be, and this is the calling that I'm meant to be doing right now, I guess. But yeah, I decided that I got tired of seeing the same things over and over again, working in the clinic, seeing all these problems people were having and being frustrated that I couldn't do more to help them. So, um, working upstream, as they say, um, in our social determinants of health class. So that's what I'm trying to do: get myself upstream, have impact at the policy level, show that it's cost effective, so we can say, it's not just the right thing to do, it's also the cost effective thing to do.
That's awesome, Jean. APHA is definitely an organization that I recommend getting involved with. And so I'm so glad that that position is open for you. And thank you so much for your service. We have just a few minutes left in our webinar. I believe that we have made it through the questions in the chat box. If I have missed your question, please go ahead and repost it. And then let us know where else your minds are at. What would be most helpful for us to spend a couple of minutes on before we sign off for the day? Jean, can you elaborate a little bit more on your capstone project and experience in completing that?
Yes. So what we ended up doing, if you had something you already wanted to work on. You were able to, work with Lisa and the faculty to get that set up. If people wanted to kind of bring their own project for the capstone. I just knew that I wanted to get experience doing research and data analysis, real life experience outside of just what we were learning in class. And so I was able to work with Lisa. They had I guess, a spreadsheet of all different opportunities that, I mean, and there was so many opportunities, all different types of opportunities. And then I was able to talk with Dr. Levin, who was teaching the class, because I wasn't sure, I was kind of between a couple ideas and I wasn't sure which way I wanted to go with that. And after talking, like I said, and this was, Dr. Levin spent time outside of normal class time, even discussing this with me, talking about like, what do you think you want to do career-wise? Maybe this would be a better fit and, for these different reasons. And so essentially me and then a couple of the other classmates, we all were doing semi-related projects with California Teacher Study. And the head investigator is an alumni of University of Michigan, which was kind of fun too. So he's out in California. We would meet with him during class. We would meet with him and his team like once a weekish, I want to say, or maybe it was every other week. But we met with him pretty frequently. It was actually really nice. They had like this whole project thing, like a timeline of what to do when, so to kind of keep us on track. Um, and so we were able to do that. And then for our capstone, we would meet with the instructor for that. So Dr. Levin, I want to say we didn't meet quite as frequently for that because everyone was kind of working on their own projects. So we would kind of come together every couple of weeks to kind of talk about things. But then you could sign up for every week. They had opportunities to sign up for office hours for anyone that wanted more time discussing their project or needed help with projects. Um, but it was really great experience. Essentially, the California Teacher Study team treated us like they were part of their staff. It was just like we were doing as if we were, I mean, we weren't getting paid, obviously, but I mean, essentially it was the real life experience, which I enjoyed. And then when it got to the second half, the ILE portion of the capstone, we got to choose what we wanted to do. And then I talked with Dr. Levin again to decide, did I want to do something different? Did I want to, work on a manuscript related to the data analysis I did? And so with her guidance, I decided and realized with her help that that was probably the best thing to achieve the goals that I wanted to achieve. And then and there was one of my classmates actually who lives in Japan. We would meet. It was just me and him that were working. We were working on separate manuscripts, but with the same team. And so we would meet with them like every other week or so to kind of go over progress. And everything was very mapped out and very manageable. So it was nice having that structure and that support. And everyone just really wanted us to succeed. And I really felt like everyone was willing to do what they needed to do for everyone. I mean, and it was kind of fun scheduling, because Ethan was in Japan and I'm in Ohio and they were in California. So we would coordinate. And I think we ended up meeting at like, I want to say it was like 4 p.m. Eastern time, which for me was great. For Ethan, it was like really early in the morning. And then for them, it was like middle of the day. But yeah, I mean, there's so much guidance, and basically you were able to adjust based on your project and who, say, your preceptor was or who were you working with, very customized depending on what your goals were. Um, so that was our particular experience. And the nice thing too is we could help each other. Our students that were working kind of similar but different projects were able to do a little bit of helping each other on the side too if we had questions about like how we were coding things and stuff like that. But lots of support.
Thank you. That all sounds really great. I appreciate you going into that a bit more.
So we will be following up via email with a recording of today's session and a lot of the key resources that we mentioned here so that you can, sit down with it and have everything in writing at your fingertips. The application season is pretty long. Even if you go for the February 15 priority deadline, you have some time to be thinking this through, putting together your application, making sure it's a good fit. We have lots of events between now and then. I take one-on-one appointments. Jean and I can take emails from you all. Feel free. I'm going to put my email in the chat box here. And you can email me directly. I can put you in touch with Jean. And
Something else to mention, I guess. Oh, sorry, I didn't mean to.
go ahead.
If anyone is concerned too, I don't know everyone's situation, but I ended up getting health insurance through the university as well. And I know one of my classmates, so I live in Ohio, the insurance is through Michigan, and one of my classmates who lived in Boston also did it. Um, and it was like incredibly affordable because I know healthcare is a big concern for people today. Um, and it saved us so much money. And this is going to sound crazy. It saved us so much money in healthcare that after the scholarship, it almost covered the cost of tuition, which is just wild. But if that is a concern for anyone, even as an online student, we were able to sign up for the health insurance, which was very generous coverage for a very affordable rate.
That's a really good flag, Jean. The domestic health insurance plan, we don't charge you a health infrastructure fee because we know that you can't always walk into the UHS, the University Health Services, from wherever it is that you're logging in from. That would be really hard. So if it makes sense for you, you can opt in and pay for the domestic health insurance plan. Your students for 2 years, you can cover dependents with it. We also, Jean, since you have graduated, the university has added a dependent care um, award, I guess. So for students who are taking care of dependents and need coverage, like service providers to come in and help, they can help offset the costs for some of those things. We're definitely here to support you as best we can.
I was shocked about all the resources because my last degree was my prior degree that I graduated with was in 2010. And so I was surprised. I told my husband, I don't know if all the universities do all these things now or if it's just Michigan that's special. So maybe if any of you all have been in a program more recently, you may know, but I was shocked at the number of resources. I just could not fathom all the things that were available. And like I said, I didn't even have time to take advantage of them all, but it was wonderful.
Well, thank you all so much for your time and attention today. Um, I'm going to re-put my email in the chat here just so that it's front and center for you. Please feel free to email me further questions. I can talk to you about whether the program is the right fit. We can sit down and rehash all of this content or talk about your specific goals. I do that often and typically more than once for prospective students. So don't hesitate to reach out. I'm happy to meet with you. I can connect you with our director, Kim Lucius, when you want to get a little bit more detailed into, what she's looking for as the admissions chair. And I can connect you with other faculty so that you can see if it feels right, right? So the faculty that you're learning from is a key component here. So sometimes prospective students want to sit down and have conversations with faculty too. That's totally fine. Thank you, Jean. Thank you, everyone. Please keep in touch and um, let us know if you decide to apply. Take care, everyone.